I am a physical therapist with scoliosis, and I had an incredible amount of pain and disability here, in the front of my leg and the back of my leg. I went to Germany, I learned about the Schroth method and the best practice, and I went to Spain and was able to recognize how my deformity was increasing through the menopause, and I was able to learn how to correct it very slowly and gentle. You can see as this time that I am able to breathe better. The first thing is I move my pelvis to the left, to the opposite side. My right side already is transforming right here at this level and making myself positioning in here. And at the same time, I'm going to lower my elevated shoulder and bring it back as much as you can. All of this has to be becoming almost effortless. And here, this part in here, I just turn it this direction and I begin to look like a model. I hope it looks like a model back there. And this is the way many times I can walk, I can iron, I can comb my hair, I can brush my teeth, I can do a haul, I can work with my patients. So this is what I was before. Right here, this is what I was before. And here is what I have been able to correct. Okay. I was before the Schroth method and the physiological method. I was totally concave, more into my spine here on the left side. You can see my convex area. And this is what I have, my shoulder is forward, my left shoulder is forward. So I have learned how to derot. First I lean back at this level, L1, L2 here. Immediately my shoulder just falls back without any effort. I'm rolling my left shoulder back and I'm going to put it right here. And that is because I'm able to walk like this. Excellent. Sometimes I pick up my luggage from here and beginning to rotate. And hopefully that shows, I don't know if you can see that, you can see how I'm able to bring my ribs forward. For resting in bed, for pain relief, this is incredible. And so I have one pillow, two pillows, the third pillow here. And I am keeping in mind to keep my physiological curves of my spine. So I have these are essential. This pillow is so essential. This is for my lumbar area. And this is the other one for the cervical area. And this is the before I go to sleep, in order to relax. It helps a lot to control if there is any pain. And I'm going to read or play with my new iPad. And notice the angle of the iPad. This is the angle that we must keep behind. So notice the pillow here in my lumbar chair and observe the angle that is much, much higher, it's much more elevated from the front and in the back. So it invites us to lean back. So this is against the position, at least for me, to how to sit. So I usually use one of these little cushions, or I use my purse. Okay, my purse, and I sit at the edge. So I'm coming back here, and I lean back into this position, you can see how immediately I change, immediately my pelvis goes forward, and I'm ready to write here on the computer, on the laptop, or on the iPad, and my position, hopefully, I'm trying to maintain my physiological position, and I can be for a long time in here, right there. This is wrong, this is the wrong position before. This is correct. Okay, and this is how I can correct myself very quick, and I am going to over-correct. So this is the new position, and I can do very well in here. The Schroth and the best practice, the physiological method. Now this is my new position, wherever I can reach that home, and I'm going to over-correct this, and this is where I go. Right there, right there, right there. And right there, right there, right there. Perfect. This feels great in here to stretch all my concave areas in here. Take a long deep breath. And here we go. 1. And rest. And 2. And rest. And then I do 50 of those. 3 and 4 and 5, 6 and 7 and 8. I be able to shift my right pelvis to the center. Then rotate my lower curve. Increase my overcorrection in my thoracic to this position to the right side, and do internal rotation with my right shoulder here and external rotation with my left shoulder. And again I breathe. 1. Correct my head and go. And pretty soon I will be able to just stay there for a few minutes. And I can feel the stretch and the strengthening of the muscles in here.